Hello, everybody, and thanks for this opportunity. I'm Tony Olivero, and I am a pediatric critical care doctor, and I want to share with you a brief story about a cool patient that I met one time. His name's Jack. He's a 5-year-old. And I came to meet Jack shortly after he was diagnosed with cancer. I came into the hospital, got his port placed, and successfully started treatment. Everything went well, and he went home, like lots of kids do after presentation. But that wasn't the last time I ran into Jack. Later that winter, he got an illness that his parents and his physicians thought was just a routine viral illness. After a few days of not getting better, they brought him to the ER where he was found to be in shock. Came up to the ICU where I unfortunately interacted with him again, and despite all of the aggressive and appropriate treatments we tried to do, Jack passed away less than 12 hours after admission to the hospital. And Jack's story is not an isolated one. Things like this happen all too frequently within medicine. So that when we think about healthcare problems, we probably can't address them all within a 5-minute pitch, but one of the biggest things that we know is there's a huge mismatch between patient needs and available resources, which leads to increased hospitalizations, increased healthcare costs, and worse patient outcomes. So for example, in terms of increased utilization, parents bring their sick kids into evaluation by physicians nearly 200 million times a year. And almost all of them are sent home with no acute interventions, no change in plans. They could have been managed at home. On the flip side of that coin are these patients that use a lot of healthcare resources and have high risks. And those are kids with chronic illnesses and chronic diseases like prematurity, congenital heart disease, chronic lung disease, seizures, asthma. For those kids, outcomes are really related to early diagnosis and treatment, and physicians and parents unfortunately don't have the available tools to get those best outcomes for those patients. Inspire Biometrics is looking to change that. We are developing the world's first pediatric biometric monitoring system to monitor vital signs in real time, transmit those data to parents and physicians, and empower those teams to make better choices and better care for kids. So the device will be thin, wearable, flexible, adhere to the torso of a child, stay in place for up to 7 days while continuously transmitting those vital signs. And again, the goal is avoiding unnecessary ER trips, unnecessary hospitalizations, and again, reducing costs and getting better outcomes for kids. There are some devices on the market. You may have seen some, but we think we are better in 3 very distinct, important ways. First is the array of sensors that we've chosen to pursue. So heart rate, respiratory rate, and temperature are some of the earliest vital signs that change in an illness, and we can track those to follow an illness's trajectory and severity. Some of the competitors use oxygen saturations, and this seems to be a carryover from the old days of hospital medicine. Oxygen sats are not an early indicator of a patient's illness, and so therefore they're not a good screening tool on an outpatient basis. We'll pursue FDA clearance, which is very important, but probably our game-breaking, game-changing factor is our data analytics. So we're going to use a proprietary data set that we have with pediatric vital signs layered on top of our clinical expertise and research experience, and develop a platform to enable parents and physicians to recognize the severity of illness and take the appropriate actions. Our revenue streams we envision in 3 distinct pathways, but interrelated. So there will be the device selling for about $4.99. We have talked to device manufacturers and expect the production cost to be about $50 per device. That will come with a smartphone app, which will enable people to see the vital signs in real time, but will require a subscription to the data analytics package to be able to interpret those data. And then telemedicine consults will be available as well. All of these we have talked to insurance and investigated, and we envision all of these being reimbursed by insurers. So we're going to really focus on the most vulnerable kids. Those are the 18 million kids in the US with chronic illnesses, kids less than 5. As we know, age is a risk factor for increased healthcare utilization. And we're going to look to partner with early adopting large medical institutes like Mott, Children's Hospital Boston, and CHOP. Our financials, we think this will be an 18-month process costing approximately $1.5 million. We think by year 2 of sales that will be net even, and by year 4 with revenues exceeding $40 million per year. We have a strong clinical expertise in our founder team, and our advisory team has a lot of startup experience and expertise as well. And we have been really lean throughout this process. So we have our provisional patent filed, proof of concept device and smartphone app, all developed for less than $20,000. So we're looking to move to a functional prototype the size of a Band-Aid. Thank you.